Hello everyone, welcome back to my channel. Today we are going to discuss about the histology of spinal cord. The spinal cord is a part of central nervous system which has a central grey matter and peripheral white matter. We have a central canal which is just little in front of the center of the spinal cord. This is little anteriorly placed and the anterior median fissure and the posterior median septum divides the spinal cord into equal halves. So anteriorly this fissure is deeper, posteriorly just in septum, that's a septum, and make sure you draw it symmetrical both the side. And cervical level we are showing in the lower part of the cervical region, which is transversely oval in shape, more white matter than the grey matter. So it is covered by a pia mater. Pia mater has two layers, epipia and pia glaya. Between them you have a pial plexus which contains the spinal arteries, the anterior and posterior spinal arteries, and the spinal veins, the 6 spinal veins. So this is a common for all the levels of spinal cord. We have to draw the section of anterior median fissure, posterior median septum, and covered by the pia mater and the vessels. Then we have subarachnoid space. Then we have outer arachnoid matter and dura mater. The gap between arachnoid and dura is very minimal. It's in millimeter. So it is difficult to make out here grossly. And the spinal cord is the easiest one to identify because you are going to see them in the dissection microscope. So when we are drawing the interior, we have an inner grey matter and outer white matter. The grey matter it's again divided into anterior horn or the ventral grey horn, which is motor in function, and the dorsal grey horn and sensory. So dorsal grey horn is slender like that, and ventral horn is very wider, especially in the lower cervical region. So the grey matter consists of the cell bodies of a multipolar neurons, the blood vessels, and also the neuroglial cells. So the multipolar neuron, as we know, it's many dendrites and axon. So the processes you have to write like a star-shaped cells and a nucleus in the center. One thing we have to make sure the cell bodies in the anterior horn are little larger in size. The axon from these cells are the one which forms the ventral root of the spinal nerves. Cell bodies of neurons present in the dorsal horn the size is comparatively smaller. They will be very small and they receive the sensory information through the dorsal root. And also we will keep the small nuclei for the interneurons. We will also see some dendrites, branching of the dendrites, and the axon beginning from these neurons. So that's the central grey matter. I'm keeping the small blood vessels here and there. Now coming to the white matter. The white matter is divided into 3 parts: the anterior funiculus, which is in front of the ventral horn, lateral funiculus between the ventral and dorsal horn, and posterior funiculus behind the dorsal horn. The white matter contains the bundles of axons which are going to form the tracts. Contain both ascending and descending tracts. So as it contains the axon, so when you are drawing, we have to keep a pink dot only because it doesn't contain nuclei. So axon contains only the cytoplasm, which is called axoplasm. So we have to keep the pink dot, and the surrounding is a myelin sheath. Myelin, when we prepare the slide, it is vanishes away because of the lipid, so it will be clear cells. So that's why the empty space surrounding the axon is the myelin sheath. The myelin sheath in the central nervous system is provided by the oligodendrocytes. which is one of the neuroglial cells. So here in the white matter, we are going to write only the axons and few blue nuclei, which I think I forgot to keep it here there. So I've kept it in the last labeling. So make sure you keep the nuclei here and there, which represent the nuclei of oligodendrocytes. They are in between the axon, bundles of axons. So one oligodendrocytes can provide myelin sheath for many axons. The posterior funiculus contains only the ascending fibers, whereas the anterior and lateral funiculus contains both ascending and descending fibers. So if you want to keep it fast, you can just put a circle and put a pink dot in the center and blue dot in between those bundles, which represent the oligodendrocytes. We'll also have some blood vessels in the white matter. So this is a cervical segment of the spinal cord. There are only minor changes between different segments. We are going to discuss all the 4 segments, the thoracic, lumbar and sacral also. Cervical is the largest enlargement and bigger white matter. You can see the labeling also. Now coming to the thoracic segment. The thoracic segment is the spinal cord to look. It is nearly circular, smaller in size compared to the cervical segment. So here also, similar to the cervical segment, the central canal is little anteriorly placed. So central canal will start, then it is lined by cuboidal or low columnar epithelium. Then we'll draw the outer part. It's almost like a circular, not oval, circular and smaller than the cervical segment. The grey matter is here we have 3 horns, the anterior horn, lateral horn and the posterior horn. All the horns are very thin. So make sure it's like a thin person, emaciated person. So thin ventral horn, thin dorsal horn, and also we can see the lateral horn. Throughout the thoracic segment, including the first lumbar segment, we have the lateral horn. So it was a little wider, so I made it circular. So when you write very lightly, it's easy for you to erase and do the shape. So and make sure it is bilaterally symmetrical. The coverings will draw first. The blood vessels, the pia mater. So you can make a notice of it. I am drawing round for the arteries, collapsed nucleus, collapsed lumen for the veins. Artery is there only in the anterior median fissure, which is the anterior spinal artery, and the posterior lateral sulcus, where we have 2 posterior spinal arteries. Whereas the veins will be there in 6 places: anterior, posterior midline, then anterolateral sulcus and posterior lateral sulcus. Then the covering. These meninges are nothing but the collagen fibers bundles, which is thickest in the dura mater. So once we finish with the covering, the grey matter will show multipolar neurons. I will little enlarge to show how to write multipolar neurons. The bigger neurons will be always present in the ventral horn. Also have some neurons in the lateral part, which is the one which produce the parasympathetic outflow. Intermediolateral group of neurons which is present in the thoracic part. Little smaller cell bodies in the posterior horn. Draw some blood vessels and also some fibers in between them, which represent the branching of these dendrites and the axons coming from them. So that's the grey matter. Keep the nuclei inside the multipolar neuron also, and also in between the multipolar neuron also, representing the neuroglial cells. Now the white matter, same as the cervical segment. You can notice the white matter is not too large compared to cervical. Cervical we have a largest white matter. The same way we have to draw the white matter here also, the bundles of axons and the nuclei of neuroglial cells, especially the oligodendrocytes and also few blood vessels. Pink dot and a circle. So one clue I can give you, so don't draw too big spinal cord. So it is very difficult to fill it up the white matter, and gray matter is easy comparatively to fill it up white matter. So draw a representative small diagram, so easy to cover all the 4 segments. Now coming to the lumbar segment. Lumbar segment, the central canal is in the center of the spinal cord. So this is the place where it is present exactly in the center. So make sure the anterior median fissure and the posterior median septum are equally placed. And it is almost upper lumbar segment, that is L1, we have a lateral horn, whereas in the lower lumbar segment we don't have any lateral horn. So the small and circular, the spinal cord. Then we have a central gray matter. It is both anterior and posterior horns are bulbous, very big, because from the lumbar segment we have lumbosacral plexus and also the lumbar plexus, which are going to supply the lower limb. So the number of neurons are more in the ventral horn and also in the dorsal horn. So the white matter, you can see the amount of white matter in the lumbar and sacral are keep on decreasing. Maximum in the cervical and keep on decreasing as it goes down. So the similar one, so central gray matter shape varies and also the overall shape of the spinal cord. So don't draw too big. Cervical is the largest. This is circular lumbar segment and wider ventral and dorsal horn, no lateral horn. Lateral horn is present only in the thoracic region, and if you take a section in L1, you may see the lateral horn, whereas in the lower lumbar segment, we won't see lateral horn. In a similar way, we'll write the vessels, meninges, keep some nuclei to show the fibroblast nuclei in the meninges, collagen fibers bundles. Now, similarly, the gray matter, we have to fill it up. Only the shape differs, but the content, they're all multipolar neurons only. The bigger multipolar neurons in the ventral horn, the dorsal horn, keep the small multipolar neurons. Size differs. Keep the nuclei in the center of the neuron, nuclei for all the multipolar neurons, and also some nuclei representing the neuroglial cells and some blood vessels. The position of central canal also, you should keep it in mind. It is anteriorly placed in cervical and thoracic, centrally placed in lumbar, little posteriorly placed in sacral segment. That's again gray matter. White matter also, same way we are going to draw the bundles of axons and the nuclei for neuroglial cells. Coming to the sacral segment. Sacral segment, the gray matter is very wide. Hardly we can see any white matter. It's very thin. So both it also has ventral horn and the dorsal horn. The segment of the spinal cord is very small and circular. So the smallest of all the segments, and very less white matter. So when you take a section, it's full of gray matter itself. So make sure you draw very less white matter even compared to lumbar segment. Ventral and dorsal horns are bulbous. Even though in the lateral group they have intermedial-medial group of neurons for the sacral parasympathetic outflow, it doesn't show any bulge in the gross, because intermedial-lateral group of neurons is the one which shows the lateral horn. Whereas intermedial-medial group of neurons will be present in the lateral part but doesn't show any bulge there. So the coverings, the pia mater, the blood vessels, the arachnoid and the dura mater and the subarachnoid space, everything is same for all the spinal cord segment because the covering is the same. the size of the segment and the proportion of white matter and gray matter different in different segments. So even here we are going to keep the multipolar neurons in the gray matter. Similar way, larger multipolar neurons in the ventral horn, smaller neurons in the dorsal horn, with some blood vessels and neuroglial cells. The difference between all the 4 segments, many of the textbook will give in the table. Make sure you know that, because spinal cord is very important both for the gross point of view and for histology point of view. Definitely they're going to ask the difference between the 4 segments, both in theory and the practicals, and both in gross and histology also. I hope this video helped you to understand this table. If you like the video, give a thumbs up, share with your friends, and subscribe to my channel. So the white matter, similar way, we are going to write the axons, the pink dot representing the axon and the myelin sheath, and here I am keeping the nuclei for the oligodendrocytes here and there. Compared to peripheral nerve, where we kept the span cell nucleus, it is different. Just keep that in mind. Thank you for watching.